Hi there. In this video we are going to discuss about hemoglobinopathies. Hemoglobinopathies. So, what are these diseases? These are basically the diseases of the diseases due to defects in hemoglobin. So, the defects in hemoglobin can be either qualitative. These defects can be either qualitative or these defects can be quantitative. These defects can be qualitative or quantitative. Quanti Qualitative defects results due to some defect in the quality of hemoglobin. Hemoglobin is produced in the normal quantity, however, the quality of hemoglobin is defective. For example, it includes sickle cell anemia. Sickle cell anemia in which hemoglobin is produced, but it is defective hemoglobin. It include hemoglobin C disease or HB, C disease, and it includes HbS-C disease. In these diseases, hemoglobin chains or globulin chains are produced, but these chains are defective. So, by quality wise, they are defective. However, quantitative diseases in which the quantity is less than normal, either alpha chain are produced less than normal or beta chain produced are less than normal. It includes thalassemia. It includes thalassemia, and these are the different variants of anemias. These are different variants of anemias because they affect the oxygen transport to the tissues. So next we come towards the sickle cell anemia. We come towards the sickle cell anemia. So what is sickle cell anemia? In sickle cell anemia, the hemoglobin synthesized is defective, and defective is in beta globulin chains. Defect is in beta globulin chains. So if we draw the structure of beta globulin chain, then in beta globulin chain the amino acids are valine, histidine, leucine, threonine, proline, glutamate, and lysine. So this is 1, 2, 3, 4, 5, 6, 7, and 8. So I have written these 8 amino acid of beta chain of globulin. So what happens, and here is the chain and so on. So what happens in the sickle cell disease? The glutamate at the 6th position, glutamate at 6th position is replaced by valine. Glutamate at 6th position is replaced by valine, and when it is replaced by valine, what happens, the hemoglobin structure at the chain, beta chain formed is called beta S, and if the hemoglobin has both chains of beta S, then that hemoglobin is called HbS. For example, hemoglobin normally have 2 alpha chain and 2 beta chains. So if they both beta chain are of S variety, then this is HbS. So when both chains will be of beta variety, we know that we have two beta globulin chains. We have two beta globulin genes, two beta genes, and if both genes are defective, then sickle cell anemia arises. So sickle cell anemia is basically homozygous recessive disorder. It is homozygous recessive disorder in which both beta globulin chains are defective. So the hemoglobin produced contain both defective chains, and both defective chains the hemoglobin formed is HbS or sickle cell hemoglobin. So what are the different symptoms of sickle cell disease? Different symptoms of sickle cell disease include pain crisis. The patient suffers from the episodes of pain, and why this pain arises, we discuss it later on. There is chronic hemolytic anemia. There is chronic hemolytic anemia, and due to hemolysis there is increased bilirubin level. So hyperbilirubinemia. There is increased risk of infections as the patient has defective immunity, because patient's spleen is defected. There is autosplenectomy due to infarction of spleen, and there is also compromised immune system. So patient have defective immunity, due to which there is increased risk of infections. So these are the moreover the transport of oxygen is defective. So patient shows the typical symptoms of the anemia here. So what is the basis of pain crisis, and what is the basis of tissue hypoxia in sickle cell disease? What happens, the hemoglobin or HbS when valine is introduced here, it introduces a specific nick in the structure of beta globulin chain. For example, supposedly this is the normal beta globulin chain. When valine is introduced, it becomes like this. Just an example. And what will happen when this hemoglobin is deoxygenated? When sickle cell hemoglobin is in deoxy state, what happens? This nick fits into the nick of other beta globulin chain. This nick fits into the nick of other beta globulin chain, and in this way, these chain get together and form polymers. They polymerize inside the RBCs, and when they polymerize inside the RBCs, hemoglobin HbS polymerizes inside the RBCs in deoxy state, and when it polymerizes, it distorts the RBC shape. It distorts the RBC's shape, and these distorted RBCs cannot pass through capillaries. They can't pass through the capillaries or microvasculatures. If we come towards the diameter, so the diameter of the microvasculature is 3 to 4 3 to 4 micrometers. However, the diameter of normal RBCs is 7.5 to 8 micrometers. So, normal RBCs squeeze through these microvasculature. However, the sickle cell RBCs having sickle cell hemoglobin have reduced ability to pass through the blood vessels due to sickling of this hemoglobin and formation of these uh, polymers of the HbS, due to which there is no passage to capillaries and they occlude the microvasculature. So, there are microocclusions. So, due to these microocclusion which occurs in HbS, there is reduced supply to tissues, and when there is reduced supply to tissues due to this phenomena, what happens? There is tissue anoxia, reduced supply of oxygen to the tissues, due to which there is pain, there is microinfarction in the tissues, and so on. So, this is the reason why patient suffers with pain in case of sickle cell anemia, and why there is autosplenectomy due to infarction, and so on. So, what is the pattern of the we should be knowing the different factors which can induce sickling. So, any factor which increases the deoxy state of HbS will increase the sickling. So, these different conditions include high altitude flight. Different conditions which can induce the sickling include high altitude flight in non-pressurized cabins, increased partial pressure of carbon dioxide, decreased pH, and increased concentration of 2,3 bisphosphoglycerate. So, all the condition which increase deoxyhemoglobin increase the sickling, because deoxyhemoglobin polymerizes and causes the sickling or painful episode or anoxic episodes. So, another thing we should be knowing about their pattern on the electrophoresis. So, it is proline, glutamate, and lysine, and then the chain continues. So, 5, 6, 7, 8. So, this is the anode or positive charge in electrophoresis, and this is the negative charge. So, this beta globulin chain has negative charge, and in electrophoresis it moves towards positive side. However, when there is HbS, in HbS glutamate here is replaced by valine. Valine is neutral amino acid. So, HbS is less negative. Normal beta globulin is more negative, while beta S is less negative. So, its movement towards positive anode in electrophoresis is slower. Its movement here is slower. HbS moves slower than HbA. So, this is the pattern on electrophoresis. So, what is the treatment of this? What is the treatment of this condition? The treatment of this condition involves adequate hydration. There should be treatment involves adequate hydration, because adequate hydration in sickle cell disease, there is increased viscosity of the blood. So, adequate hydration ensures that viscosity is reduced. Adequate hydration ensures kidney function is normal. Okay, so it also ensures there is normal blood flow, regularized blood flow. Moreover, Due to pain episode, there are given analgesics to manage the pain crisis, and there is also antibiotic therapy. There is also antibiotic therapy to tackle the risk of infections. And moreover, there is the blood transfusion can also be given. However, the chronic blood transfusion can lead to the risk of hemosiderosis due to iron overload. Okay, so blood transfusion is also a treatment option here. And moreover, there is a drug called hydroxyurea. Which is an anti-tumor drug. It increases the level of fetal hemoglobin, or HbF. So HbF contains gamma chains instead of beta chains. So it also reduces the RBC signaling due to increased level of HbF. So this is the treatment of sickle cell disease. There is an advantage of heterozygote. We discussed that this is the condition which due to defective beta chains, and due to defective beta chains, the RBC's lifespan is reduced. And this reduced RBC lifespan, preferably in heterozygote condition, proves helpful against malaria. Because in heterozygous condition, what happens in heterozygous condition? One beta chain is defective, and one beta chain is defective, patient has normal lifespan, so there is no as such pain crisis which occur in homozygous condition, and no specific treatment required. So heterozygous condition have less reduced RBC span. However, they don't show the typical condition of sickle cell anemia, for example anemic sign, pain crisis, hyperbilirubinemia, chest syndrome, stroke, splenic and renal dysfunction, bone marrow changes, etc. These changes are less marked in heterozygous condition. So heterozygous condition proved helpful against malaria, especially in the areas where malaria is endemic, for example in the African regions. So this is the selective advantage of heterozygote sickle cell disease. Next we move on about the another disease, which is hemoglobin C disease. Now we discuss a disease called hemoglobin HbC disease. So what happens in HbC disease? In HbC disease, here at the 6th position, instead of valine, here comes lysine. So the hemoglobin produced in this way is called HbC. However, it is a less severe variant. So there is mild chronic hemolytic anemia. So these patients don't suffer from the infective crisis, and no specific therapy is required. It is a mild variant, so in this case there is no specific treatment or specific therapy is required. However, when lysine is here intruded, so its movement towards anode is more slower, because lysine is basic amino acid which is already positive charge, so it further reduces the inactivity of HbC, so its movement towards positive node in electrophoresis will be more slower. So there is another variant of this disease, which is HbSC disease. So what happens in this disease? In this disease, both hemoglobin HbS and HbC both are present. So patient is heterozygote, but the both beta genes are defective. One beta gene synthesizes beta S and other beta gene synthesizes beta C. So patient has both hemoglobin HbS and HbC, which is called HbSC disease. So that patient is called doubly heterozygous patient, and in this condition the clinical symptoms range from mild to moderate, but they are less frequent and less severe, and there is significant clinical variability of the symptoms in this condition. Next we come towards another disease, which is methhemoglobinemias. So what is methhemoglobinemias? Hemoglobin, the iron present in heme of hemoglobin, iron present is in ferrous state, Hb2 positive. However, if it is oxidized to Fe3 positive, then the hemoglobin is called methemoglobin. So this oxidation can occur in response to certain drugs, for example nitrates. It can occur due to reactive oxygen species uh, produced inside the body, and so on. So what is the consequence of this oxidation? This meth hemoglobin cannot transport oxygen. It cannot transport oxygen because it does not bind oxygen. It does not bind oxygen, so it does not transport oxygen. So how this condition is, if oxygen is not transported so by meth hemoglobin, then the blood turns into chocolate colored, and the skin also skin and mucous membrane becomes cyanosed because of lack of transport of oxygen, which is called chocolate cyanosis. Chocolate cyanosis. So to tackle this risk physiologically, there is an enzyme in body called NADH methemoglobin reductase. NADH methemoglobin reductase, or it is also known as NADH cytochrome B5 reductase. So this enzyme, what does it do? It naturally or physiologically reduces the Fe3 positive back to Fe2 positive. So it physiologically reduces meth hemoglobin back towards normal hemoglobin. However, in the infants or newborns, the activity of this enzyme is less than adults. So newborns are more prone to the meth hemoglobinemias because of reduced activity of this enzyme. Adults have increased activity, so adults have less risk of meth hemoglobinemia. However, the newborns have greater risk. So to treat meth hemoglobinemias, what drug can be used? Methylene blue is used to treat the risk of meth hemoglobinemias. So next we come towards another hemoglobinopathy, which is thalassemia. So we previously discussed that thalassemia is basically it is a quantitative disorder in which there is reduced quantity of globulin chains. So globulin chains of alpha and beta variant. So thalassemia is also of alpha and beta variant. It can be either alpha thalassemia, there can be alpha thalassemia, or there can be beta thalassemia, depending upon which globulin chains are defective. So beta thalassemia are basically due to point mutation in the beta thalassemia gene. These are due to point mutation, and alpha thalassemia is basically due to gene deletion. It is due to deletional mutations. So alpha genes are four. There are 4 alpha genes in humans, and beta genes are 2. So 2 beta genes. So if this beta chain production can range from either decreased production of beta chains, which is represented by beta positive, or no production of beta chain, which is represented by beta naught. Okay, so if one gene is defective, then there is decreased production of beta globulin chain, and this condition is called beta thalassemia minor. Beta thalassemia minor, or it is also called beta thalassemia trait. However, if both genes are defective, then there is no production of beta gene, and when there is no production of beta genes, this is called beta thalassemia major. It is called beta thalassemia major in both genes are defective. So there is no beta thalassemia trait or beta thalassemia minor is a mild condition in which one gene is working. So this patient have some normal hemoglobin, so they don't show the typical symptoms. However, the patient of beta thalassemia major becomes severely anemic. These patients become severely anemic initially when these new children are born. When newborns initially have HbF. HbF have alpha 2 and gamma 2 chains. So as long as HbF is present in a newborn does not show the sign and symptom of anemia. However, within 1 to 2 years of age of the newborn, HbF level declines. When HbF level declines, what happens? Then to synthesize HbA, there are no beta globulins. So there is no beta globulins. The patient becomes severely anemic. So this patient also suffered the extra skeletal changes due to extramedullary hematopoiesis, and they require lifelong the blood transfusions, due to which hemosiderosis may occur due to iron overload. So to tackle the iron overload, iron chelation therapy is used to dissolve the iron and get rid of overloaded or extra iron. And the last ditch treatment is bone marrow transplant in beta thalassemia major. Okay. However, in beta thalassemia minor, there is one defective gene, so the patient has better prognosis as compared to beta thalassemia major, and they continue to work on only one beta globulin gene. So it was about beta thalassemia, in which the primary defect is a point mutation in beta globulin chain, due to which either beta chain production is decreased substantially by B positive, or there is no production, which is shown by B naught. If one gene is defective, then one gene continues to work, so condition is beta thalassemia minor. It is a mild condition. However, if both genes are defective, then condition is called beta thalassemia major, in which there is no production of beta globulin. So the newborn is healthy for about 1 to 2 years. However, then it becomes severely anemic because fetal hemoglobin declines at this level, but to synthesize HbA there are no beta chains. So this patient requires lifelong blood transfusion. Blood transfusion lead to the iron overload. So to tackle iron overload, iron chelation therapy is used, and then bone marrow transplant is necessary for their better prognosis. Then we come towards the alpha thalassemias. So alpha thalassemias, there are 4 alpha genes. So depending upon the defect, they have different variants. For example, if one gene is defective, then the condition is called silent carrier of alpha thalassemia. Silent carrier of alpha thalassemia, they don't show the clinical symptoms. Okay, if 2 genes are defective, then the patient is called having alpha thalassemia trait. Alpha thalassemia trait, which is also a mild condition. It is also a mild condition. However, if 3 genes are defective, then the conditions are called, then the condition is called HbH disease. HbH disease, it is mild to moderately severe hemolytic anemia. It is mild to severe hemolytic anemia. In this condition, what happens? Only one alpha gene is working, so some amount of hemoglobin will be formed. However, in rest cases, beta globulin chain will form beta globulin tetramers. So it is called HbH disease, and it leads to the moderate, mild to severe hemolytic anemia. And if all 4 genes are absent, if all 4 genes are defective, then the condition is called HB Bart disease. In this disease, there is no synthesis of hemoglobin, and no synthesis of hemoglobin due to no alpha gene, and fetal hemoglobin is also not formed. So there is fetal death in this case, hydrops fetalis, and fetal death due to accumulation of gamma chain. Gamma tetramers are formed in this condition. So there is fetal death in the fetal life, and intrauterine death can occur due to hydrops fetalis. So alpha thalassemia, in the alpha thalassemia, there are 4 alpha genes. If one gene is deficient, then there is silent carrier of alpha thalassemia. 2 genes are defective, alpha thalassemia trait. And if 3 genes are defective, then HbH disease, which is mild to severe hemolytic anemia. In this condition, some amount of hemoglobin is formed. However, the beta chains form tetramers, which lead to the anemic episodes. And if 4 genes are defective, there is no hemoglobin synthesis. This condition is called HB Bart disease, in which in fetal life, gamma chain form tetramers and cause severe hemolytic anemia. So it was all about the hemoglobinopathies. Thank you.